In an acute rehabilitation setting, there's nothing wrong with commonly used therapeutic shoulder exercises like these. They can be very beneficial in reestablishing motor control and general activation of the shoulder musculature, which is shut down because of surgery, injury, or trauma, or to help establish mind-muscle connections in less severe situations where joint pain exists. The problem occurs when these same exercises are recommended as a home exercise program following discharge from therapy, with no advice on how to progress to traditional strengthening exercises that do a better job of strengthening the same muscles, when the program also includes progression with loads across a spectrum of repetition ranges. In other words, these exercises should be seen as early stage rehab exercises as opposed to what the individual should be doing perpetually. Too often I'll see people in the gym performing rehab exercises as their primary exercises, and it's obvious they were never counseled by a therapist to transition to a strength and conditioning program as soon as possible. So let's quickly go through some exercises one by one. This ball circles against the wall exercise needs to be ditched following discharge from physical therapy. It's a low-level isometric exercise that does not provide enough resistance to strengthen anything. I wouldn't even recommend it as a warm-up or activation exercise prior to a shoulder workout because you'll get much more bang for your buck warming the shoulders up with traditional warm-up sets for the exercises you're about to perform. And you're better off strengthening the rotator cuff with lifting and lowering movements, which are concentric and eccentric contractions, with exercises I'm about to cover in this video. You can also ditch this side-lying rotator cuff strengthening exercise and these W's with a TheraBand exercise following discharge from therapy. The W's with a TheraBand exercise only provides some resistance at the very end of the range of motion when your shoulder is at maximal external rotation. During the initial and middle stages of the movement, the band isn't on enough tension to provide any meaningful resistance. By the time you reach the end of the movement where you're feeling the resistance, the exercise has done nothing more than provide some low to moderate isometric tension. And unless your rotator cuff is extremely weak, it isn't strengthening anything, and definitely not strengthening outside of a beginner range of strength. Even when a towel is placed between the upper arm and torso, this side-lying rotator cuff exercise tends to have too much involvement of the deltoid and isn't adequately isolating the muscles you want to isolate. This exercise should really only serve as a phase 1 rehab exercise in most cases. The individual should quickly be progressed to something like this: the 90-90 dumbbell exercise while lying prone over a ball. Or even better, if the person has access to a cable machine, they can perform this 90-90 strengthening exercise for the rotator cuff. Another great exercise, which mimics a backhand swing in tennis, hits both the deltoid and the rotator cuff, and should be included in everyone's shoulder strengthening program, is this cable lateral raise. So ditch the TheraBands as soon as possible and progress to using dumbbells and cables. Additionally, you should remove this WISE exercise from your program in favor of progressively strengthening across a spectrum of repetition ranges using a low to high cable reverse fly. Replace this low-level tease exercise, lying prone over a ball and using weights that are too light, with either this traditional dumbbell reverse fly exercise, lying over an incline bench using appropriate loads, or this cable reverse fly exercise where your arms remain approximately parallel to the ground during the entire movement. Throw this eyes exercise completely in the trash because you're working the same muscles during traditional rowing movements such as seated rows, cable rows, and lat pull downs. And there's really no need to isolate the back of your shoulder or posterior deltoid after you've been released from PT. This is another example of a phase 1 rehab exercise that people should very quickly move away from if it's really even needed at all. And then make sure you replace this very low activation wall slides with a TheraBand exercise, which doesn't provide enough resistance to strengthen anything unless the person is extremely weak, since it's just the weight of your arms pushing out slightly into an elastic band, with either this landmine shoulder strengthening exercise with a barbell, this landmine shoulder strengthening exercise with a cable, and overhead shoulder pressed exercises, whether seated or standing, such as these. Always make sure that when you've been discharged from physical therapy, you also discharge yourself from the standard 2 or 3 sets of 10 repetitions protocol and strengthen over a wider spectrum of repetition ranges with various loads. A great suggestion would be to focus on these exercises in the 10 to 15 repetition range, spending a 2 to 4 week phase at 13 to 15 repetitions, followed by a 3 to 4 week phase at 10 to 12 repetitions with slightly heavier weights, making sure that you progress within each phase so that you're a little stronger at the end of the phase than you were at the beginning. Then move to the 8 to 10 repetition range and start shifting the emphasis more towards lateral raises, scaptions, pressing exercises, and wide grip upright rows. And then move to the 6 to 8 repetition range or below and stick solely with pressing exercises and upright rows, since the focus at this point should be pure strength. Therapeutic exercises in a physical therapy setting are great for physical therapy. But once you've been released from PT, it's time to change your mind frame to a legitimate strength and conditioning mind frame. To avoid re-injuring your shoulders and to reduce or completely negate joint pain, you need to progressively strengthen the tissue. And this will never occur by perpetually sticking with low volume, low intensity rehab type exercises. You have to take off the training wheels.